What if the way you sleep tonight, the exact position you're lying in right now, is quietly putting your brain at risk? It sounds almost impossible to believe, but doctors say millions of seniors are doing this every single night without knowing it. Your sleep position can affect your breathing, your blood pressure, your circulation, even your acid reflux. And it can be silently working against your brain health for years without a single symptom to warn you. So today, we're going to walk through exactly what the research says about the safest and the riskiest sleeping positions for people over 60. Stick around until the end, because the position most people assume is safe might actually surprise you, and the one habit doctors warn about most is coming last. Here's the thing, after 60, your body changes in ways you can't feel happening. Your blood vessels grow stiffer with age, making it harder for blood to move through them the way it used to. High blood pressure, diabetes, high cholesterol, these become far more common, and each one chips away at healthy circulation. So when you stay in one position for 7-8 hours straight, it can quietly put pressure on blood flow and breathing that a younger body would simply shrug off. And here's why that matters so much. While you sleep, your brain depends entirely on a steady, uninterrupted supply of oxygen to repair itself. Disrupt that night after night, and over time, it can take a real toll on your brain health. So, before we talk about sleep positions specifically, let's back up for a second. What actually happens during a stroke, and why something as simple as a nightly habit can play a role in preventing one? A stroke happens in one of two ways. Either part of the brain suddenly loses its blood supply, or a blood vessel bursts. The first kind, called an ischemic stroke, is by far the most common, making up almost 90% of all cases. It happens when an artery feeding the brain gets blocked. And here's the frightening part. Once that happens, brain cells start dying within minutes. Every second counts. That's why doctors created a simple way to remember the warning signs fast. Face drooping, arm weakness. Speech difficulty, time to call for help immediately. Acting fast can be the difference between a full recovery and permanent damage. Now, to be clear, your sleep position alone won't cause a stroke, but it can quietly influence some of the biggest risk factors: your breathing, your circulation, your blood pressure, and how much oxygen actually reaches your brain overnight, especially if you're older or already managing another health condition. So which position raises the most red flags? Doctors keep coming back to one in particular: sleeping flat on your back, especially past age 60. Now, this isn't dangerous for everyone, but for some older adults, it can quietly worsen something called obstructive sleep apnea. Here's what's happening while you sleep. Lying flat on your back lets your tongue and the soft tissue in your throat fall backward, narrowing your airway. That means your breathing has to work harder, and sometimes it gets blocked altogether. These repeated blockages can drop your oxygen levels, jolt you awake without you even remembering it, and send your blood pressure spiking, all while you're sound asleep. Do that night after night, and you're placing real strain on your heart while quietly fueling inflammation, both of which are linked to a higher risk of cardiovascular trouble down the road. If you're carrying extra weight, snore loudly, deal with high blood pressure, or already have sleep apnea, this risk climbs even higher. So, what does the actual science say about the connection between how you sleep and your stroke risk? Let's dig into the evidence. Researchers have found a strong link between untreated sleep apnea and a higher risk of stroke, particularly in older adults, and the mechanism behind it is honestly a little unsettling. Every time your breathing pauses during the night, your blood oxygen drops, over and over. This triggers your body's fight or flight response even while you're fast asleep, flooding your system with stress hormones you never asked for. The result? Blood pressure often spikes in the early morning hours, and your blood vessel walls take a repeated beating. Do this for months, even years, and the cumulative damage can meaningfully raise your cardiovascular risk. Now, it's important to be honest here. Correlation isn't the same as direct causation. Your sleeping position doesn't automatically cause a stroke. But it absolutely can influence risk factors that are already well established in medical research. That's exactly why doctors routinely ask stroke patients about their sleep habits afterward. They're hunting for treatable problems that could help prevent it from ever happening again. Now, here's a question worth asking yourself tonight. Is your body already sending you warning signs you've been brushing off? Loud snoring, waking up, gasping for air, morning headaches, a dry mouth that won't go away. These can all be your body's way of telling you your breathing is being interrupted while you sleep. Many seniors also deal with daytime exhaustion, trouble concentrating, high blood pressure first thing in the morning, frequent trips to the bathroom at night, or stiff neck and shoulder pain that lingers after waking up. On their own, these signs don't necessarily mean something serious. But if they keep showing up or start getting worse, please don't brush them off. And if a spouse or partner has ever mentioned you snore loudly or seem to stop breathing at night, that's your cue to bring it up with your doctor. Catching a treatable sleep problem early could be one of the most protective things you do for your long-term brain health. Of course, not everyone carries the same level of risk. If you're over 60, you're already more vulnerable than you were a decade ago. But that risk climbs even higher if you're carrying extra weight, managing high blood pressure, diabetes, heart disease, or you've had a previous mini-stroke, medically known as a thanks in advance. Smoking, heavy drinking, a family history of stroke, and untreated sleep apnea all add fuel to the fire. And if you regularly take sedative medications, that can worsen breathing problems overnight too, depending on the medication and your overall health. Here's the part that really matters. Though these risk factors don't just add up, when several show up together, they can multiply, placing extra strain on your blood vessels, cutting off oxygen delivery, and dramatically raising the odds of a serious cardiovascular event. So, which position actually earns a doctor's approval? For most older adults, sleeping on your side tends to come out on top for both breathing and overall sleep quality. Depending on your specific health conditions, many experts lean toward the left or right side rather than flat on the back. Side sleeping helps keep your airway more open, improves oxygen flow, reduces snoring, and can ease the severity of sleep apnea for a lot of people. But positioning is only half the equation. Proper neck alignment matters just as much. A supportive pillow that keeps your head and spine in a neutral line makes a real difference. And placing a pillow between your knees can ease pressure on your hips and lower back too. Add a mattress that offers real support, not too soft, not too firm, and you're setting yourself up for spinal alignment that lets your body actually rest, instead of quietly fighting against gravity all night long. So what can you actually do starting tonight? Protecting your brain begins with consistency. Go to bed and wake up at the same time every day, and aim for 7 to 9 hours of real quality sleep. Skip the large meal right before bed, cut back on alcohol, and ease off caffeine later in the day so it's not secretly keeping you wired at 11 p.m. Stay hydrated during the day, keep moving with regular exercise, wind down with a calming evening routine, and work toward a healthy weight to support better circulation and breathing. And don't underestimate your environment. A bedroom that's cool, quiet, and dark creates the ideal conditions for the kind of deep, restorative sleep your brain and heart depend on. Now, sleep position matters, but let's be honest, it's not the biggest player here. Certain medical conditions carry a far heavier weight when it comes to stroke risk, and these should never be ignored. Obstructive sleep apnea, uncontrolled high blood pressure, atrial fibrillation, diabetes, high cholesterol, carotid artery disease, obesity, and chronic kidney disease. Each one can damage your blood vessels, choke off healthy blood flow, or raise your odds of a dangerous blood clot. But here's the encouraging part. Proper diagnosis and treatment can significantly bring that risk down. In most cases, managing these underlying conditions does far more to protect you than adjusting your sleep position ever could. That's exactly why regular checkups, taking your prescribed medications, and sticking with healthy habits Let's make this practical. A simple nighttime routine can go a long way. If your doctor recommends it, check your blood pressure before bed and take your medications exactly as prescribed. If you've been prescribed a CPAP machine, use it every single night, without exception, because consistency is what makes it work. Spend a few minutes gently stretching to loosen tight muscles, and make sure your pillow is actually supporting your neck and spine, not fighting against them. Steer clear of sleeping face down, and if your doctor advises it, slightly elevate your head. Finish with a few minutes of slow, relaxed breathing, and keep your bedtime consistent night after night so your body and brain can truly rest. Before we wrap up, let's clear up a few myths. Sleeping on your back will not automatically cause a stroke, and one rough night's sleep isn't going to trigger one either. Your body is more resilient than that. Special pillows might improve your comfort or alignment, but no pillow on earth can prevent a stroke on its own. And here's something worth remembering. Even people who feel perfectly healthy should get a sleep evaluation if they notice loud snoring or breathing pauses. Snoring is sometimes completely harmless, but when it's loud and persistent, it can be your body's way of flagging sleep apnea, a condition that deserves real medical attention before it quietly raises your long-term health risks. So here's the bottom line. Your sleep position can influence real, meaningful risk factors for stroke, especially if sleep apnea or other health conditions are already part of the picture. Tonight, take a moment to really think about how you sleep, and please don't brush off persistent snoring or any of the warning signs we talked about today. Now I want to hear from you. Drop a comment below and tell me, which position do you usually sleep in? Has anyone ever told you that you snore? And if this video helped you, subscribe for more on healthy aging, brain health, heart health, and stroke prevention.